Staging of the carcinoma cervix. So firstly, in stage 1, it is limited to the cervix. So here there's type A. A is nothing but the microscopic lesion, and here A1. A1, if you see, it's stromal invasion. Stromal invasion is less than 3 mm. This is the depth. Then looking at A2. A2 is nothing but a stromal invasion. It is greater than 3 mm and less than 5 mm. This is the depth. Next, looking at B. B, there is macroscopic. In macroscopic lesion, there is B1 as well as B2 and B3. So here in B1 there is stromal invasion and it is greater than 5 mm depth, and the tumor size is less than 2 cm. Now looking at B2, it is greater than 2 cm, less than 4 cm. B3 is greater than 4 cm. B is nothing but the macroscopic lesion. Now looking at the stage 2. Stage 2 involves the upper 2/3. This is of the vagina, and A extends to the upper 2/3 without the parametrial involvement. So there is no parametrial involved. Now looking at A1. A1 is less than 4 cm. A2, if you see, it is greater than 4 cm. Now the B. In B, it extends to the parametrium but no pelvic wall. Now moving on to the stage 3. The stage 3, there is it involves the lower 1/3. This is of the vagina, and again there is A, there is B, and there is C. So in case of A, it extends to the lower 1/3. This is of the vagina, and then looking at B, it extends to the pelvic wall. That is the hydronephrosis and the non-functioning kidney. Now we look at C. C is involvement of the pelvic and para-aortic lymph node. Pelvic as well as the para-aortic lymph nodes, and this is irrespective of the tumor size and the extent. So now looking at C1 and C2. C1 involves the pelvic node and C2 involves the para-aortic nodes. Now moving on to the first type 4. The stage 4 is nothing but the metastasis, and this includes type A and type B. Type A is nothing but the bladder and the bowel movement. Bowel is involved, and B is nothing but the distant metastasis. So here when the bladder and the bowel is involved, also the pelvic organs which are adjacent to it can be involved.